Hello, my name is Michael Humphrey. I'll be 65 this year. I live in Clayton, North Carolina. Hi, I'm a patient of Dr. Rao's here at Vascular Solutions in Cary, North Carolina. I was advised to come here from my doctor, Dr. Nador. He says, got a treatment that's probably will work good for you. I wanted to exercise more. I wanted to have more mobility, and he thought that was a good fit. Some of the symptoms I was having dealt with my knee pain, sharp knee pains, going up and down steps. Later on in the painfulness of it, it started turning into sciatica, where I had a hard time even driving down the highway. It was working its way into my hips, and so I needed some solutions. I thought the solution would probably be knee surgery, so that's what I was talking with my doctor about. Knee replacement surgery was a thing that I was considering because that's all I heard of. That's all I knew was go out for about 6 weeks and you'll come up with some brand new knees. So that's the path I was looking at and traveling. I had a hard time trying to find the right fit, so I asked my primary doctor about it. My pain level before the procedure was, according to the chart that we had, was very high. I remember sleepless nights, limping, and I did not want to do the job I was working. I work with the city training new people, and I have to get down there and show them. So it would hurt me the days afterwards to just have mobility. So that pain level was high, very high. I would say my pain level out of 0 to 10 was probably about a 9.5. The first time I came to the center, we had to examine my knees to make sure the surgery would fit, or it was matching up to what they were looking for. And the staff was great. It was great. The table was a little cold, but the service here was great. The people are friendly, knowledgeable, and helpful. The procedure itself it seemed about an hour. It was an option of being knocked out or just relaxed, a sleepy state, or I could stay awake. It was the medicine, I think, was a Benadryl type medicine that made me a little drowsy, but I took advantage of it and got me some good rest in. I could hear the surgery going on, and I was comfortable doing the whole surgery. The operating room was professional. There was training going on, as I remember, and so that's great too, to expound upon this knowledge, then to move it out with some other people as well. Once the procedure was over, I remember them rolling me back just outside this door here, and within 30 minutes to 45 minutes, I was comfortable. I got up, moved around, walked, did steps back and forth, turned around, and no pain. Right at that moment, no pain. After the procedure, the only discomfort I had was right around where the incision went in, and I would say that was probably a pain level of like 2, maybe 2.5. But my knee, that evening when I got home, I went straight upstairs with no pain. After the surgery and getting back home, I had a rest period of keeping my legs up and iced for the swelling. The next day, I was able to just function. By the third day, I was ready to go back to work, but took advantage of it, stay home another day. But it was a quick turnaround, very quick turnaround. One of the things that changed after I had the surgery, I was able to walk faster, walk further. And my doctor suggests don't be running. I'm still a little too heavy to run. So I wanted to, use this opportunity to get down in weight as well. Quality of life is a lot better without that pain, without being able to sleep well, to be able to drive, as a matter of fact. Right after the surgery, I think it was that next weekend, I drove to New York with no pain versus going to work in pain, driving 20 minutes in extreme pain in the vehicle I was in. If you are considering any type of knee surgery, I would advise to look into this option before you do that. That cut is a nice little scar, and the pain is not guaranteed to be over, but I'm not pain-free. I would say from the 10, I'm only like a 1.5. There is a little bit of pain if I do certain movements, but compared to previous, I don't even remember the pain. So I would advise to try this option before you try any type of knee surgery. Being pain-free does increase my happiness level, whereas I'm not feeling anxious, or can I do this, can I go here, or I can do things now that I couldn't do before. Traveling is much easier as well. I was suffering, we went to St. Martin, and I was suffering on the plane because of my knees. We were cramped in a cramped airplane. So we're gonna travel again this week, this month, and I'm looking forward to seeing how I feel after that one as well. The improvements I find from this type of surgery, it made my work a little bit better. I had thought about basically retiring within the next year, but this allowed me to extend that time comfortably to get people trained at my job. Also, it allows me to be more mobile when I'm doing the other types of work that I do beyond the job, my normal 9-to-5 job. I would advise anyone to look at this seriously and then make the move for it. It's a good option. My coworkers were surprised about the quick return, how quickly I returned to work, and then how soon I was back out into the field. It was basically no time, and it was a lot more comfortable. I was a lot more comfortable doing the job, and even though I'm older, I still brag to the younger people, why am I beating you guys to these points? Let's hustle up, show me how young you are. The staff here at the Vascular Center are great. Everybody's friendly. Youth, there's a lot of youth here, which means there's a lot of experience happening, and they can only get better. I like it. I like the spirit here, and it's a great place, and it seems like it'd be a great place to work as well. My experience with Dr. Rao was a pleasant one. I met him before surgery. He was friendly, explained everything that was going on, or that would be going on. And it was just like he said, and checkups afterwards, very concerned, and they're very proud of their work, I can tell.